Welcome back to The Explainer. Today, we're skipping past all those sketchy online scams, the so-called magic pills, and those late-night internet ads. Instead, we're diving directly into the real urological science of penile measurement, anatomy, and the actual clinical reality of what works and what absolutely doesn't. Okay, let's take a quick look at our clinical roadmap for today. We're going to cover establishing the baseline with accurate measurement, understanding small penis anxiety, and then 3 free at-home methods: losing weight, safe grooming, and muscle relaxation. Finally, we'll wrap up with long-term health and avoiding scams. All right, starting with section 1, the baseline, getting an accurate measurement. So before we can even talk about improvement, we have to establish a true baseline. And it's incredibly easy to make a mistake when doing this at home. You can't just place a ruler against the surface of your skin. To get a medically accurate number, you actually have to press the ruler firmly, indenting it all the way down until it hits the pubic bone you can feel beneath the surface. Then ensure the anatomy is fully stretched or erect, and only then do you measure to the tip. It's a highly standardized clinical process. But hey, as you do this, keep in mind that measurements naturally fluctuate. The room temperature, your physical comfort in the moment, your level of arousal, these all play a massive part. Day-to-day fluctuations are completely normal based on your environment, so you're really looking for a consistent average over time rather than stressing out over a single snapshot. Moving into section 2, understanding small penis anxiety. It's absolutely crucial to understand that small penis anxiety is often rooted in a very real psychological condition called body dysmorphic disorder, or BDD. This causes severe distress and a constant preoccupation over a perceived physical flaw, even when a person's anatomy is perfectly average or sometimes even above average. This requires the empathy, care, and guidance of a mental health professional, not just some aesthetic fix. You know, your brain is a powerful organ, and treating you as a whole human being is the essential first step here. Okay, section 3, method 1 for maximizing length, losing weight. When we look at the actual anatomy, an enlarged pubic fat pad literally covers the base. It's kind of like an iceberg. The erectile tissue, those 2 spongy bodies, actually goes deep into your pelvis and turns downward into the perineum. So gaining weight in the pubic area literally buries your natural length under a layer of fat. But when overall body fat is reduced, it reveals that deep tissue anchoring into the pelvis. 2 to 3 centimeters. That is the exact amount of length that many men think they've physically lost since their 20s. They look down and genuinely believe their anatomy has shrunk. But the reality? It hasn't shrunk at all. It's simply hiding behind pubic weight gain. Now, because you can't just spot reduce fat specifically from the pubic area, adhering to overall foundational health habits is absolutely key. We're talking about engaging in cardiovascular training, hitting the weights for resistance training, upping your dietary protein, and eating fibrous, natural foods while cutting out the unprocessed junk. By bringing down your total body fat through these habits, you'll naturally reveal that hidden anatomical length that has literally been there all along. Which brings us to section 4, method 2, safe grooming. The mechanics behind this optical improvement are incredibly simple. Just like the pubic fat pad we just talked about, pubic hair acts as a visual obstruction covering the base. By simply trimming or shaving, you completely remove that obstruction. It instantly makes the penis appear larger because you're uncovering the base of the anatomy. It achieves a very similar visual effect to weight loss, but pretty much immediately. But, and this is a massive but, safety is the critical point here. If you happen to be a diabetic with poor blood sugar control, an accidental nick from a razor isn't just some minor annoyance. It can lead to a severe, absolutely devastating infection known as Fournier's disease. You have to be incredibly careful. If you fall into this high-risk category, you should for sure stick to careful trimming rather than bringing a sharp razor anywhere near the skin. All right, on to section 5, method 3, muscle relaxation. This is where the mind-body connection gets really fascinating. In a high-anxiety state, your body is tense and the smooth muscle in the penis is physically constricted. That active constriction limits its visible resting size. But in a low-anxiety state, that smooth muscle actually relaxes. By consciously working to reduce your anxiety, whether that's through meditation, exercise, or chatting with your doctor, you physically relax that smooth muscle. This instantly allows for a larger resting appearance and, crucially, facilitates much better function and erections. Finally, section 6, long-term health and scams. So why do nighttime erections matter? This is a critical question for your long-term prognosis, guys, because it dictates the actual physical maintenance of your urological tissue over the course of your entire life.
Here's how this builds a case for your long-term health. While you're sleeping, nighttime erections deliver continuous, healthy blood flow to those tissues. Think of this regular blood flow as vital preventative care. Without it, the tissue just isn't getting that steady oxygen supply. Over time, a lack of blood flow can cause internal scar tissue to form. And avoiding that scar tissue is literally what stops the penis from physically shrinking as you age. It's truly a use it or maintain it system. I want to be definitively clear here, guys. No magic elixir, no supplement, no special pill that people are aggressively trying to sell you online is going to elongate your penis. Now, sure, some erectile dysfunction supplements might improve your rigidity and help prevent that scarring we just discussed, but absolutely no magic pill will add physical length to your anatomy. Please do not fall for the traps and waste your hard-earned money.
So, the ultimate takeaway from this explainer really boils down to one simple question. Are you ready to stop chasing cosmetic illusions and start investing in your true, long-term urological health? Reject the scams. Instead, invest in yourself through a healthy diet, exercise, and mental well-being to maximize the healthy functioning anatomy you already possess. The real power isn't sold in a bottle. It's built in your daily habits. Thanks so much for learning with us today, and we'll see you in the next one.